I'm sitting here with the one and only Dr. Blau. He is the Gynecomastia surgeon extraordinaire, and you have a new book out, Masculinity Defined. I've been waiting for this book to come out for 10 years. You've been talking about doing this book.
That's right.
The definitive guide to gynecomastia. Explain to me how this came about and what made you finally do it.
Okay, when I started to do like a few hundred gynecomastia cases a year, I decided, because of my expertise, I have to share it with other physicians and other patients.
Which is very unselfish of you, because a lot of physicians want to keep all their secrets to themselves. You believe in spreading the knowledge, obviously.
Yes, because I think that this surgery, it's not really, I don't think it's purely cosmetic. I think it's more medical. People that have gynecomastia, especially when it's severe, especially people that are bodybuilders, I mean, it really disturbs them. It's
emotionally disturbing.
And that's right, emotionally, and sometimes also physically, because sometimes it's painful, sometimes there is discharge. And of course, I mean, people that are not bodybuilders, when they have severe gynecomastia and they go to the beach or they go to the pool, they don't want to take their shirts. I remember a patient, he was actually a college professor, and he didn't take his shirt off in front of his sons and grandsons for, I would say, probably 20 years.
20 years, wow.
20 years, his children and his grandchildren didn't see his breast because he had a huge gynecomastia. And I did a surgery on him, I think, about 5 years ago. And since then, I'm in touch with him, and he says that he has a pool, and now he goes to the pool, he takes his shirt off. So there are a lot of reasons why people want to do gynecomastia.
Well, bodybuilders specifically, which you have a lot dedicated to that in here, and I know I mentioned a few times in here, I was interviewed obviously, but bodybuilders have a different mindset. We're on stage presenting our physique to the judges, and this is like one of the first things you see is your chest. And if you have, glands hanging down, that don't belong there as a male bodybuilder, because we want to have a well-defined lower chest, it's messes you up mentally, because there's nothing you can do in the gym to burn the fat off or to build more muscle there. If it's not surgically removed, it's never going away.
Oh, let me tell you, that's interesting, because also I do now a lot of wrestlers. Actually, I did at least 15 or 20 wrestlers, and the association many times send me now some patients, some wrestlers that think they need it. Also, I did in the book, I wrote about Navy SEALs that I did. Actually, two friends, they became friends there in the West Coast, and they became friends because they both had gynecomastia. Everybody told them, oh, you don't exercise enough, you don't lose weight, and they were
Navy SEALs, yeah.
Navy SEALs, excellent physique. And then they came here, they did the surgery. So after the surgery, when they went back, everybody said, oh, we told you, you were now on diet, you lost weight, and they had no idea they had
all they had was surgery.
That's right.
Well, the great thing about this book, I think, is that a lot of people, the surgery is an easy surgery as far as surgeries go. Obviously, your skill makes it simple, but the procedure is, for anyone to go and have surgery voluntarily, it's mentally tough to do that, because it's not like you're just taking a medication and getting rid of something. So this book is great because it kind of lays out the process, the thinking process, the emotional process, and the obviously physical process of what goes on in the surgery, so that if people will read this book, it'll kind of allay their fears more.
That's right. I think so. Because somehow, to compare it to women, when they have breast augmentation, they tell everybody, they don't care if it doesn't look natural, that's okay. And there are 500,000 ladies in the US that are doing it every year. Men, there are only 23,000 male that did the gynecomastia this year.
And you did 19,000 of them, probably.
Well, I do 2% of the gynecomastia in the US.
That's a lot.
But they are afraid. They're not going to say, in spite of the fact, women, it's an implant. Men, you just take some tissue. It's not even an implant yet. They are much more reserved. But I think recently, because of this book and other reasons, men are talking about this a little bit more, and I predict that in 10, 15 years, men are going to talk about gynecomastia the way that women talk about breast augmentation.
Almost like the way, when girls hit like 18 or 16, they want to get a nose job because they've been thinking about their whole life. It's that guy who went to summer camp and his kids ridiculed him because he has something hanging down there that shouldn't be there. He's waiting until his 18th birthday or whatever, and he can do it to get. When is the right time? What's the youngest age you would do it?
Actually, if it's severe, we can do it as young as 11, 12,
oh, really?
Or maybe even before. Because if it's severe, it's not going to go away.
Right.
Gynecomastia that you have for 6 months, that's it. It's not going to go away. No medication, nothing, because then it becomes fibrotic, and it just, the gland is going to stay there.
Okay. It's good to know.
So you really can do it in any age. Young age, it prevents a lot of psychological problems. And I do a lot of very young people.
I didn't even know that.
Actually, in my book, you'll see I have a few very prominent pediatricians. And they were sent, actually I interviewed them because they were sent by the American Society of Pediatrics. And we spoke to them about gynecomastia, and I told them that basically gynecomastia can be done, like I told you, in any age, even in young age, and it's going to really save those people from a lot of suffering in the future.
Sure.
Only in severe cases. But in that case, if I do young people, the parents have to be involved, sometimes the pediatrician. So.
Now you talk about in the book, and we've discussed this before, a lot of bodybuilders have gone to other surgeons, and the surgeon's afraid to take out the entire gland because they tell them, oh, the nipple is gonna concave in, it's not gonna look right. And so these people listen to the surgeon, they get the surgery, and then they wind up coming to you to get a revision because the gland doesn't, there's still something there, it still doesn't look right. And you have kind of engineered for the bodybuilder the idea of removing the entire gland. Explain to me why.
Okay. The first thing I saw when you don't remove at least 95 to 98% of the gland, it always comes back, and sometimes it really grows. Actually, you just stimulate the gland, but by taking a little piece of the gland, you just stimulate it, and it grows and becomes even bigger.
So glands can actually increase in size, even if there's only a little piece there. It can actually hypertrophy.
Absolutely, it can, and that's what happens in many cases. I do every year about 150. A gynecomastia patient that already had the surgery done. It's also in the book. And so about a third of what I do a year are people that already had it done, and then they have to come to have the surgery again, and it's a suffering, the payment. So, and that's just because there are some plastic surgeons that just don't have enough experience with this. They still do it, and they're not sure how much to take. And usually, as you say, they leave too much, and then it stimulates the gland, and then it grows.
And it's not a cheap procedure. So if you're going to get it done right the first time. Come to Dr. Blau. If you got to fly, I know a lot of people fly here from other countries. Even I mean, you have an international clientele.
That's right. So. Actually, last month, I think, didn't I send you the article? I had an article about 1,600 bodybuilders, and the article was in the PRS, which is the official journal of the American Society of Plastic Surgery, and it's intended for plastic surgeons. So it was a big article. And we have really, here international physicians. I mean, I have about at least 70 people a year coming from other countries, and the same amount of probably 100 patients a year that come from other states.
Which is very impressive because most doctors don't have that. Their kind of clientele is around where they live, but the gynecomastia, you kind of have forged the, I guess you could say, the industry, because maybe in 10 years from now there'll be more local people that know what they're doing, but it seems like you're the only kind of guy that really knows, if you want to get your gynecomastia removed, how to do it properly. And the funny thing is, people think it's a complicated procedure. If you know what you're doing, it's fast, because most of your surgeries are under an hour, right?
Yeah. Let me tell you, if I do breast augmentation, it takes me 20 to 30 minutes. So this is complicated compared to breast augmentation. I mean, I don't think anything in plastic surgery is complicated if you have enough experience, you know what to do. If you don't know, it's a problem. And the same with gynecomastia. I trained surgeons and plastic surgeons the coming year. I mean, every few weeks I have somebody, and I don't mind to teach them. And I did a few board certified plastic surgery. I did a gynecomastia. Actually, next week I have a very prominent plastic surgery. He's the head of the plastic surgery department in one of the 3 biggest hospitals in New York City.
He's coming to see you?
He's coming to have the surgery, not to see me.
Oh, to have the surgery. Wow.
to have the surgery.
That's a real feather in
So
your cap.
I do a lot. I do many physicians.
You should
and,
he should have written the intro to the book.
That's right. So
Well, the book is available on Amazon.com for ebook download, or you can get the I'm getting the hardcover. No one's getting the hardcover, but we do have a lot of soft covers available. If you're going to get the surgery, you're thinking about the surgery, you know someone who needs the surgery, buy them a copy of this book so that they can read the procedure, what goes on, what happens, so they know what to expect. He's the best. And
Thanks.
Dr. Blau, always a pleasure to see you anytime I can, and congratulations on the book.
thanks. I appreciate, and you are the main reason that I do today gynecomastia. I must finish with this.
Thank you so much.